I have with me Harish Gudi, CIO of Optum India. According to you, what do you think is happening in the whole health tech sector?
There is better care, there is better procedures available today, but more expensive.
As a technologist, with the kind of innovations that's happening, which one are you most excited about that can bring a big shift in the whole healthcare industry?
I think there are three things that are really exciting me and are going to make a difference to affordability, access, and outcome. Number one,
So, Harish, there's a lot of discussion on value-based care. Can you first tell us what that is and what is the shift from episodic care to value-based care?
it's a big shift that is happening in the industry, like we talked earlier. If you look at healthcare costs as a percentage of GDP in the country, I think it's rapidly rising. Now the question is, how do we manage that better with better outcomes?
Tell me, how do you think AI is transforming healthcare industry?
If there is a job that AI should do and will do, healthcare is probably the most consequential job that AI will do.
Welcome to a fresh episode of Simulated Reality Podcast by AIM Leaders Council. I'm Vandana Nair and I have with me Harish Gudi, CIO of Optum India. Thank you, Harish, for taking the time to speak to us.
Vandana, it's a pleasure to be here with you.
So, Harish, let's begin with I want to understand the whole market. Now, with the healthcare industry rapidly changing, you have a lot of market dynamics which is changing, customer perceptions which are changing. So, according to you, what do you think is happening in the whole health tech sector?
Look, from a shift perspective, there is a rapid change in the ecosystem in healthcare that is happening. And I would say there are three main challenges in the industry as we see in the United States. Also in many places and many other countries, the challenges tend to be similar. In the US, here is what we're seeing. We're seeing challenges in and around how we make cost of healthcare lower, which is all about affordability. Number two, how do we make access to healthcare easier? So we call that access. And last but not the least, how do we focus on quality of outcome of healthcare? The challenge is not just about meeting these demands or needs individually. It's about how do we do all three of them together, right? That's the difficult part. Now, if you look at affordability, what's really happening is the cost of healthcare in the US is rising at a pace that is faster than inflation, number one. Number two, there are better, more modern medicines available today, but more expensive. There is better care, there is better procedures available today, but also more expensive. If we do not manage the situation well, the cost of healthcare is going to shoot up beyond being affordable to all the people who actually need the care. So that is challenge number one. Let's talk about accessibility. No matter which part of the world you go, US included, access to care in the most remote part of the country or locations, when needed, continues to be the big challenge, and how do we solve for that, right? That's a big one. Last but not the least, how do we shift from care being about sporadic treatment when an event or an episode happens versus ensuring that we take care of health in such a way that the outcome, the overall outcome is better and it's not just about episodic intervention. Like I said, it's about getting all these three together and solving for them together. In the middle of all these, two more things to remember. One, lots of administrative, procedural process overheads in the system. How do we reduce administrative burden? So if I'm burdened with administrative overheads, my focus on you as a consumer, as a patient goes down, right? And I think this is what has to come together in an overarching theme where it continues to be human-centric and human making the decisions. That's the name of the game.
All right, that sounds interesting. And as a technologist, with the kind of innovations that's happening, which one are you most excited about, like that can bring a big shift in the whole healthcare industry?
But then as a technologist, I'm excited about everything. But if I were to look at healthcare in particular, I think there are three things that are really exciting me and are going to make a difference to affordability, access, and outcome. Number one, I think there is a sea shift happening in the mind frame and mindset of this person not being a patient but a consumer. What that means is when you start thinking of your patient, your provider also, and put them in the center of the universe as a consumer, and you implement technology, surround with innovation, surround with care, and surround with outcome, it changes the game. So I'm very, very excited about consumer experience centric solutions, right? Whether it is find and price care, whether it is appointment scheduling, whether it is providing the right level and verified information about conditions, looking up nutrition, looking up diet, and all of these become very, very important from a consumer experience perspective. Number two, I think along with consumer as the center, there is a shift towards focus on wellness, right? With all the information that is available today, with focus on nutrition, diet, well-being, exercise. Let's talk technology, IoT, devices that can tell you how your health is progressing. Bringing all that together to be able to predict a need before it arises really, really excites me, right? Now, last but not the least, a lot of these are built on a foundation of a digital platform. So what excites me is the journey of building a core digital platform that enables data interoperability with consent, of course, to be able to create those innovations that we are talking about at the edges. Innovation happens at the edges of data, at the edges of system, and that's why interoperability is very big. These three things, I think, are going to make the change happen in the industry.
So Harish, there's a lot of discussion on value-based care.
Yeah.
Can you first tell us what that is and what is the shift from episodic care to value-based care?
Okay. So let me say this in like simple terms.
Sure.
What is value-based care about? It is about shifting from volume to value, number one. It is shifting from fee-for-service model, right, to a quality of outcome-based model. Right? Let me explain this from the patient-consumer perspective. Let me give you an insight from a caregiver-provider perspective and also from the insurance provider-payer perspective. Right? From a patient-consumer perspective, what value-based care does is that it focuses on your outcome, your well-being, and able to put together all the information that you need to be able to create better affordability and better accessibility and better outcome for you as a consumer, as a patient. From a care provider perspective, physician, provider, nurse, it makes sure that it puts together the data and makes it easily available, reduces administrative overhead, and ensures that resources, staff, amenities, hospital beds, everything that is available is optimized and used in such a way that care can be better and more people can be taken care of in a more timely manner.
Yeah.
More importantly, the shift from what you said, from just treating that situation or condition that happened, to be able to prompt about keeping the patient well or healthier, and what are those things that we can do, right? It gives and empowers the physician nurses with that ammunition and information to be able to make the right decision. From a payer perspective, it's all about that dollar, every dollar. How far can I take that dollar and make every dollar count in terms of access to care and in terms of affordability? When you solve these three things, what happens is the entire healthcare system, which is VBC, moves from an episode-based treatment paradigm to a wellness-based, prevention-based paradigm, which changes overall quality and outcome of health.
And this shift is what is happening now, right? That the focus is more on that.
It's a big shift that is happening in the industry, like we talked earlier. If you look at healthcare costs as a percentage of GDP in the country, I think it's rapidly rising. Now the question is, how do we manage that better with better outcomes?
So Harish, let's talk about the most important thing, AI. Now we're seeing how AI is transforming a lot of industries, and healthcare is no exception. From say diagnostic accuracy, streamlining administrative process, and a lot of things. So can you throw some light on how this is happening in healthcare, and also, if possible, where are the AI use cases that are there in United Health Group and Optum?
Look, AI is making access to data, analytics, predictive modeling, everything more seamless. NLP is creating wonders, right? Because of all this, we are able to bring together vast amounts of data and be able to analyze them, like whether it is EHR data, wellness data, wearable data, social determinants of health. How do we bring it all together to be able to do like a predictive kind of modeling in scenarios? I think that's what AI is doing to the industry. From a use cases perspective, there is more than 100 use cases that we have at Optum. But more importantly, what we have first is a well-defined and clear structure on use of data, which is responsible use of data, and responsible use of AI. In healthcare, everything has to be explainable, right? So AI doesn't make the decision for you. It gives you enough information so that the care provider, human in the middle, right, can make the decision. I think that's very important. Now let's look at use cases, right? Yeah. If you look at the customer centricity, right? From a customer's perspective, many use cases that help you find care, price care, make appointments, automate follow-ups, and all kinds of use cases that are available from a consumer perspective. From a provider perspective, we're able to bring together all the data that I talked about, which is EHR, social determinants of health, and put it all together to be able to give a care plan, which is a best practice. So this AI can learn from best practices, create a best practice plan, and make that available, a predictive plan available to the care provider, who are able to make well-informed decisions. So that's on the care side. There is also a lot of work happening on the administrative side, removing administrative steps, procedural steps using AI. There is a lot of communication that goes out, right? Communications, AI is able to automate. Many times they are in dozens and dozens of languages, right? So there's a bunch of clinical help use cases and a large bunch of administrative, operational efficiency use cases that are available in AI that we are working on. Also, public health trends, right? AI can predict, monitor public health trends. It can be watchful and predict outbreaks that are happening. It can predict and give us signals on vaccines that will be required. Yeah. That helps optimize the entire system, right? The vaccine is not just about it being there when you go. It's about the manufacturing process, the shipping process, and everything that goes behind the scenes to get that vaccine there on time. Yeah. So the earlier you can predict these kind of things, the better you can service the consumer. And AI is helping with all of that today.
So Harish, coming to the end of this, I have a question for the future. So now technologists, to adapt to the evolving healthcare ecosystem that's happening, what kind of skills and qualities do you think they should be having to kind of match the scale of evolution that's happening?
So, Vandana, if they're technologists, they're already great at technology. The one thing that they now need to bring to the table in this healthcare ecosystem is to bring people, process, technology together with, like I said, consumer in the center. When you bring all of this together, that is when magic can happen, by bringing the power of AI, bringing the power of digital, and bringing the power of zero distance. What do I mean by that? I mean, don't sit in some cubicle somewhere and think of some new healthcare app that is going to make a difference. It's not going to happen like that. You have to be able to bring all these elements together, which means you have to be zero distance from the consumer. Develop your solution zero distance from the consumer. Yeah. Zero distance from the care provider. Zero distance from the advocate who is also helping the consumers. If you develop your AI, your digital interventions, your platform with this in mind, following all the clear structures, methods and guidelines that the organization provides for you, I think you can make a hell of a difference. I think we are at the cusp of making magic to be able to make the healthcare system work better for everyone.
All right, great. Yeah, so thank you so much, Harish. This is truly insightful. Thank you for your time.
Thank you, Vandana. It was a pleasure and hope to see you sometime again soon.